So good afternoon all. This is on tissue processing, like how we are receiving the gross specimen and how we are preparing the slide. So basically today the class is on tissue processing. So here you can see first we will receive the specimen. So once the specimen comes, we will check with that hospital number, name, those the things whether they are matching with the specimen container and with the requisition form, also online requisition form. Then we will give the biopsy number for that case. Then the specimen will go to the grossing room where we will do the gross examination and will do the grossing and all. Then that tissue will go for fixation. Then there are some further steps also, like dehydration, clearing, impregnation, then embedding, then the tissue sectioning, then the slides are not prepared. So this is the automatic tissue processor. So once we grossed, that specimen will be put it in a small cassette, and that thing will go into this basket, and in this tissue processor only the initial steps and all will happen. These three things will happen in that automatic tissue processor: the dehydration, clearing, and then impregnation. So the aim of the tissue processing is to embed the tissue in a solid medium, then it will become firm to support the tissue and give it sufficient rigidity to enable thin sections to be cut and yet soft enough not to damage the knife. So while cutting, that knife shouldn't damage. So when we are getting the bone and all, it's rich in calcium, so that won't be soft enough to cut by the knife. So that will go for decalcification. So basically dehydration is the removal of water. So the reason for that is to make the sectioning easy. So once the dehydration is not proper, the further steps will not be proper. So the most commonly used dehydrating agent is the ethanol. So the duration of dehydration also varies depending upon the tissue thickness. If the tissue is more than 5 mm thick, then it will take more time, like it will take up to 90 minutes or longer. Then clearing. Clearing is if there is any excess alcohol which is present in the tissue during the dehydration process, that will be cleared in this step by using the xylem. So here the clearing agent is the xylem. Then impregnation and embedding. In the impregnation method, we will use the liquid paraffin, which makes the tissue thick, so that it can be cut properly. Then for embedding, we are using the paraffin wax. Paraffin wax is used because it has a wide range of melting point. Commonly we are using common melting point we are using is 55 to 58 degrees Celsius. So the tissue processing also, there are two methods. One is machine processing, another one is the manual. Here we are using the machine processing. The automated tissue processor, here the device can handle the larger number of tissues and process more quickly and produces better quality outcome. There are two types of devices. One is the tissue transfer or dip duct, another one is the fluid transfer or enclosed. Here you can see this is the tissue transfer type. So this is the basket carrier, this is the basket carrier and this is the receptacle basket. Inside this, these are the receptacles. It can be stainless steel or plastic. These are the cassettes. In this only, when we are cutting the specimen into small pieces, it will be put it in this basket. So then there is one circular deck which holds that reagent beakers. So this is the tissue transfer. Here this tissue will be transferred from one basket to the another. So this is the tissue transfer. the enclosed type. In this, the reagent will be transferred. The tissue will be in the fixed place only. The reagent will be transferred. So the advantages of automated tissue processor is it saves time, that decreases the human error. There will be effective fluid circulation. The temperature can be adjusted. Vacuum or pressure can also be incorporated. So this is your embedding station. So these are the molds which are used for the embedding. After that paraffin wax embedding, the tissue will appear like this only in the cassette. This is only kept for filing, and from this only we are cutting the sections also for H&E staining. Then another one is frozen section. For that we are using a separate machine. This is the cryostat. In this, the temperature is around less than 20 degrees Celsius. So here the tissue will be freezed so that it will become hard, so that it can be easily cut, and then it's stained by rapid H&E staining, and we used to screen the slides also immediately. So when the frozen section is used, so when there is a need of margin, or when there is a doubt whether the patient is having a malignant tumor or benign tumor, that time from the OT they used to send the sample. We used to immediately cut it and stain it, have to see and have to make a diagnosis within half an hour. Then decalcification. Once we are receiving bone or any hard tissue, that will go for decalcification. So there are two methods of decalcification. One is the acid method, another one is the chelating agents. So in the acid method, we are using formic acid or nitric acid. Then chelating agent is EDTA. So bone marrow samples are decalcified in the EDTA sample. EDTA. This video you can see here, you will be understanding like how they are receiving the specimen and how the slides are prepared from that specimen. The entire step is shown in this video. So you can watch this. there are some other special stains also we are using in the histo. So like if we have any doubt for fungal organism, then we will ask for PAS or GMS. Then if we have any doubt for mucin in the malignancy, whether it's a mucin producing tumor or not, then we will ask for Alcian blue. In that also, PAS also stains the mucin. So like this we are using some special stains also. Then there is one more technique, that is immunohistochemistry. That is if we are having any doubt of malignancy, like what malignancy it is, whether it is a muscle organ or neural organ or it is a vascular tumor. So in that case, whether when we are not able to make sure about what organ it is, then we ask for some immunohistochemical markers which tells the origin of the lesion. Like SMA is for smooth muscle, then S100 or SOX10 for neural organ. Like that we will ask some IHC markers to make a diagnosis. So these are some things we are using and we are doing in the histo. What is the commonly used fixative in histopath? It's just formalin. Like what's the percentage? Okay.